All right, welcome back. I hope you're having an awesome time so far. Our next speaker is Jordan Silberman. He's the Director of Clinical Analytics and Research, Digital Care Delivery at Anthem. Please join me in welcoming Jordan to our virtual stage.
Thanks so much, Patrika. Great to be here, and thanks to AI for the invitation to present. Go ahead and share my screen, and we will get started. Okay. I'll be sharing some thoughts about AI applications in digital health and opportunities to really impact outcomes and costs by leveraging AI effectively in the digital health domain. I'll focus on three key areas. First, AI applications to increase scalability of digital health interventions. Second, AI applications to predict acute clinical events at short time intervals. Third, applications to optimize digital health interventions for underserved communities and to meaningfully reduce healthcare disparities. First, though, I'll share a little bit of context, starting with a working definition for digital health. This set of definitions has been proposed by the Digital Therapeutics Alliance, the Digital Medicine Society, HealthXL, and Node, the network of digital evidence. So it's coming from a number of different organizations, and they've got these three classes for sort of digital products that are relevant in healthcare. And for our purposes, I'm going to define a digital health intervention as a product meeting three criteria. First, the product's value is contingent, at least in part, on the degree to which it improves one or more health outcomes. Second, the product falls into at least one of the three classes of digital tools outlined here. And third, it's not a software application that's used as part of an FDA cleared or approved medical device. Okay, so the specific types of digital tools that I'm focused on here include apps that are designed to support chronic condition self-management, and that could include apps for weight management, for diabetes prevention programs, for managing diabetes, hypertension, other conditions. Digital health products in this category could include integrated wearables, could include things like smart mats that you step on to help monitor diabetes control and specifically foot care for patients with diabetes. Those are just a few examples of the kinds of digital health tools that I'll be talking about today. For some brief context, I direct clinical analytics and research for the digital care delivery team at Anthem, which is a large US payer. And so one of the things that I spend a lot of time doing is looking carefully at digital health interventions and digital health vendors and doing evidence assessments to help evaluate candidate digital health vendor partners. So I spend a lot of time looking at like dozens and dozens of digital health solutions that Anthem is considering making available to our 42 million members. And the North Star in that process is asking the question, what is really truly going to help a patient? We see a lot of solutions in digital health that have a lot of hype. We see others that are really cool, but you know, aren't necessarily gonna help a patient. And so we really try to focus on what truly has a shot at moving the needle on health outcomes and also on healthcare costs. Um, so with that context in place, um, I'll delve into a few details around these three key opportunities to apply AI in the digital health domain. And, you know, the identification of these three areas is based on experience looking at dozens and dozens of digital health vendors with an eye toward what really has a shot at helping a patient. Um, so first, AI application to increase scalability in digital health. So scalability is often touted as a core value driver in digital health, and very often health coaches are incorporated as part of a digital health intervention. Often you've got something like an app, maybe integrated wearables, and then you've got an opportunity to work with a coach, often through an app, um, and that coach can provide accountability, can provide evidence-based education, can apply evidence-based behavior change practices, and so on to support patients in chronic condition self-management. It's just one of the things that health coaches can do. So a lot of health coaching incorporated into digital health interventions. And then for some digital health interventions, we even have incorporation of clinical pharmacists, even physicians or other healthcare professionals. And that human involvement in a digital health intervention has really been shown to, in many cases, improve engagement and outcomes. Okay. Um, what that creates is a trade-off in many cases between scalability and efficacy. I wish that were not the case, but when you look carefully at the data, often it just is. And so you have to make decisions about what to prioritize there. So a key opportunity is to be able to classify patients into groups that are likely to show improved outcomes when they have that human involvement, when they have that health coach or that pharmacist or that physician in the loop as part of the digital health intervention, okay? Versus a class of patients who are going to do well with or without having a human in the loop. And the more we are able to do that classification, the more we will be able to optimize resource allocation so that we are, giving the health coaching intervention component to patients who are going to benefit, but we are not necessarily introducing that intervention component to patients who are going to have the same outcome with or without it. And if we can get really good at that, if we can apply AI to get really good at that, then we may have an opportunity to really increase scalability, because now you need less of that human interaction, and you're able to automate more and provide a effective digital health intervention to more patients with the same level of resourcing invested. Okay, so that's an exciting opportunity, and many relevant stakeholders who may be considering offering digital health interventions, covering digital health programs. For example, self-insured employers who are deciding, do I want to make a digital health intervention available to an employee population, right? They often have an ROI threshold. And so, if we're able to improve ROI through this approach, we may be able to increase the field of digital health interventions that can be offered to relevant populations, and that could be a really good thing at the end of the day for patients who now have an opportunity to get more digital health interventions. So that's an exciting opportunity. Second key opportunity is around predicting acute events at shorter time intervals. On the slide here is the American College of Cardiology 10-year risk score. This is used all the time clinically, for example, to decide whether or not a patient is a good candidate for a statin, okay? And they're predicting likelihood of acute cardiovascular events over a 10-year period, which is great to be able to do, and it can be very useful clinically. We have less of an ability right now to predict events in the near future. And that's an area where we may be able to apply AI in the digital health domain and really create value by doing so. I would just emphasize, to allay any concerns, this would never be used for underwriting. There would, of course, be challenges related to the risk-benefit trade-offs and risk for potentially creating patient concerns, but that's all very solvable. And I would be confident that there are opportunities to develop algorithms where the benefit strongly outweighs the risk. Let me give a few examples here. And these are examples specifically where you would be using data generated from a smartphone or from wearables to predict acute events days to months in the future. And a great example is in epilepsy. We know that there are all sorts of things that impact a patient's likelihood of having a seizure at any given moment of time. And in addition to medication adherence and how long it has been since getting an anti-epileptic medication, important determinants of the of seizure risk moment by moment include stress level, include sleep, include alcohol consumption, and quite a few other predictors. And those are things that can be monitored. So you can imagine a solution where a patient, let's say, who is is generally well controlled on an anti-epileptic drug, they have a period of a few days where they are getting less sleep for whatever reason, and that's detected using a sleep tracker. And then we're able to predict that, hey, this patient's risk for a seizure in the very near future is increasing. And then we can do things like, sending the patient an actual notification to inform them that that's happening, or to to provide a nudge toward a nudge toward improved sleep health, to improve seizure risk. You can imagine other applications to predict episodes of ketoacidosis for patients with diabetes, and giving them an opportunity to correct, to take appropriate steps with insulin management and so on to help address risk for DKA. And we're even working on a tool that does this for patients with asthma. It's in very early stages, but as part of a collaboration with Apple and with the University of California at Irvine, we're running an initiative called the Asthma Digital Study, where part of this decentralized randomized control trial will investigate whether we can predict asthma exacerbations and loss of asthma symptom control early on in that process, and thereby allow patients to respond more proactively than they can today. Okay, so to summarize, what we're able to do here, what we have an opportunity to do here is to use data generated from digital devices, from wearables, from smartphones, in order to predict acute events at shorter time intervals, and thereby allow patients and or members of a patient's care team to be more proactive in managing chronic conditions. That may really provide an opportunity to improve outcomes and reduce costs at scale. Third key opportunity is to apply AI in order to optimize digital health interventions for underserved communities and meaningfully reduce disparities. And strategies here include two main things. One, optimizing the fit between a target population and a specific digital health intervention. Two, customizing digital health interventions for underserved populations. So it's about selecting the right digital health tool for a given population, and then customizing that tool to serve the population's needs. And there are so many things to consider when choosing a digital health intervention for a given population. Okay, for example, if you are targeting a Medicaid population, as we are currently with some of our digital health work at Anthem, you ideally want to have some input from that population early on in the development of the digital health tool that you are deploying. Okay. Broadband is a real issue in some populations. Actually having adequate internet accessibility. An often overlooked concern among some patient populations is whether or not there is a private space available for them to utilize a given digital health intervention. So if you've got, for example, a telehealth program where a patient is really going to want an opportunity to interact with a provider through a digital portal, and to do so privately, that can be a real challenge for certain populations. And due to limits in internet connectivity and limits on availability of a private space, for many populations, digital health interventions that incorporate simple text messaging can be very helpful. Another important consideration is um, whether or not the relevant evidence is generalizable to the target population. So when you're choosing a digital health intervention for a given population, you ask the question, does the evidence supporting the effectiveness of that intervention generalize to the population I want to target? Did they actually study patients in their clinical trials that look like our target population? And so when you're optimizing fit between the patient population and a given digital health intervention, you've got a lot of opportunities to apply AI in order to predict for this given unique patient population which digital health intervention is most likely to be safe and effective, which is likely to be well accepted, to achieve high engagement rates, and to reduce costs and so on. Another important opportunity, again, is around applying AI to customize digital health interventions for patient populations, and that can be done on the basis of things like cultural background, socioeconomic status, literacy levels, health literacy levels, digital literacy, numeracy, and so on. Again, a lot of opportunity here to apply AI in order to predict which customizations are most likely to benefit which patient populations. So a lot of opportunity there to apply AI, to sort of combine AI with digital health solutions in order to meaningfully and measurably reduce healthcare disparities. Before summarizing, I would reiterate the importance of focus on what's really going to help a patient, and realizing the potential of AI as a tool within digital health will require us to go beyond, go beyond the buzzwords, go beyond hype, and really focus on what's got a true shot at improving health outcomes, what's really got a shot at improving healthcare costs. So just really important to stay focused on that. To summarize here, we've talked about 3 key opportunities to apply AI in digital health. These are by no means the only opportunities, but they are a few that, in my opinion, have the potential to provide true value. They do, in my opinion, have a real shot at improving health outcomes at scale. And so we talked about using AI in digital health to help classify patients into those who are likely to have better outcomes if a human is in the loop versus those who are going to have a favorable outcome with or without that human element. We talked about using smartphone and wearables data to predict acute events days to months in the future and facilitate more proactive chronic condition management. And finally, we talked about applying AI in digital health by using patient level data to customize digital health strategies for underserved patient populations, and really using AI and digital health together to help create measurable and meaningful improvements with respect to healthcare disparities. I will stop there. Again, I want to thank AI4 for the opportunity to present, and look forward to your questions.
Awesome. Thank you so much, Jordan. I know the audience is giving you a huge virtual round of applause. So thank you for sharing these insights with us today. For the audience, it's time for you to make your way to your next session. Along the way, make sure you accept your connection request and take some time to check out our amazing AI exhibits. Thanks so much, and we'll see you around.